Contact tracing feels like a strategy we talked about last year, when you had to isolate prior to vaccines. Well, there are contact tracers still at it today, and they told our Steve Steger the wave of cases primarily among the unvaccinated now has them as busy as ever.
Here's how I spent part of my reporting day today, in line at Centennial's Community Testing Center, getting the tickle that so many of us have become accustomed to. I had a COVID exposure this week, one I learned about on my own, not through a contact tracer. It made me wonder if they are still at it, with vaccinations changing the game.
Unfortunately, vaccination has not taken care of the need for contact tracing.
So I asked my health department, Tri-County Health.
We're still attempting to reach out to everyone to do case investigation and contact tracing.
That's Jennifer Chase, an epidemiologist who leads Tri-County's contact tracing effort, which she says hasn't stopped, partially because so many people haven't been vaccinated.
We have shortened our investigation window, meaning we can't reach out to every single individual by phone because there are so many cases.
This intense wave of cases reminds her of last fall when they just couldn't keep up.
So we're reaching out to people that are in high-risk situations.
While all of that remains the same, so much has changed. It's getting harder to investigate cases because we aren't as locked up as we used to be.
People are getting out and going out to restaurants and seeing friends.
The age of short staffing is also impacting contact tracers.
Attrition in this work is pretty high. People get burned out pretty quickly with this level of work and investigation.
And those at-home tests have also changed the game, since a lot of times people aren't reporting their positive results. Bottom line, contact tracers are still out there, but when cases are this high, the work gets tougher to do.
The contact tracing is a bit more challenging now than it was in the beginning of the pandemic.
For Next, I'm Steve Steger.
Steger got that brain tickle today. Health departments are hearing from people who are confused after they test positive with an at-home test, not sure what to do next, especially if they're vaccinated. So this is a reminder that the state has a website where you can enter your results and your situation, get instructions about how long they recommend you quarantine. And if you're curious, you're always just welcome to call your county health department for advice.